Good morning, everyone. Welcome to our virtual Health Talk Immunization Awareness. This is the second webinar of the Health Talk series for 2021. My name is Diana Hualpa from the Hidalgo County Wellness Program, and I'm really glad that you joined us today. Before we get started, I want to make sure that our technology is working for us today. So if you can see our lights clearly and if you can hear my voice clearly, would you please click on the raise hand icon that is located on the bottom of our Zoom webinar software. Again, if you can see my slides clearly and if you can hear my voice clearly, if you could please click on the hand icon that is part of our Zoom webinar. Thank you so much. It looks like we're good to go technology-wise. I do have a couple of reminders before we get started. Reminder number one is that this month we have 2 additional webinars. The first one is going to be this Friday, which we're going to be discussing what is that we can be expect from a counselor. And also the second one is on Monday, June 28, which is how to motivate, engage, and retain staff. This webinar is part of our 2021 leadership series. So therefore, I highly invite you to register for these webinars after this immunization awareness webinar. Okay, so the second reminder that I have right now is that you are on listen only mode. However, you are able to submit your questions via our Q&A forum on our Zoom webinar software. At this point, I do have the pleasure of introducing our guest speaker for today's presentation. Dr. Audrey Gutierrez graduated from medical school from the University of Texas Medical Branch in Galveston in 2017 and completed family residence from Christus Santa Rosa in 2020 as a co-chief. Dr. Audrey Gutierrez is board certified in family medicine and currently serves in South Texas Health System clinics. Without further ado, I pass it over to you, Dr. Gutierrez. Thank you so much for joining us today. And I think your mic is currently mute, Dr. Gutierrez. Okay. It looks like we're having some technical difficulties, so just give us a couple of minutes and we'll make sure to start shortly.
Hi, good morning.
Good morning, Dr. Gutierrez.
Hello?
Thank you so much for joining us today.
Come in.
Hello, Dr. Gutierrez. I think we're ready and you should be able to share your screen at this point.
Hi, good morning, everyone. I'm Dr. Gutierrez. I'm sorry, I'm running a little bit late. Patient care is always first for me. Let me go ahead and bring up my PowerPoint. Okay, so today we are talking about immunization awareness. And, especially during this time where we have COVID going on, I think this is a really important topic because, a lot of people have pushed out their annual wellness visits. And this is when we normally talk about immunizations and, what immunizations you need, what you'll need in the future, making sure that everything is up to date. And because people have been pushing their wellness visits back because of COVID, I think this is a really, really important topic. And, definitely just encouraging everyone to go out and call their PCPs to make their annual visits for your labs and all the other preventative type procedures that we normally like to do. Okay, so why are immunizations important? There's a lot of reasons. These are just a couple. So we want to try to keep people as healthy as possible, right? That's our line of work, is that we want to keep people safe, we want to keep people healthy, and we want to keep people out of the hospital, and we want to prevent deaths. So this is definitely something that immunizations have done. And I'll show you some graphs in just a little bit. We want to
Dr.
prevent
Gutierrez, I think we're not
complications
able to see
from
your screen at
diseases.
this point.
So, in the past, when there was things like mumps, there were men, who we find who were not fortunate to get the immunizations when they weren't around, that would get complications of virility, which means basically because they had mumps, the inflammation affected their reproduction system, their testes, which made them not be able to have children in the future. So, other complications, definitely just like lifelong things as far as, lung problems, liver problems, vision problems, hearing problems, some of the diseases that now we don't see because we have immunizations used to cause things like that. And so just complications that were lifelong for people. Okay. Let me share my screen. There we go. Is that better?
Yes, that's great, Doctor.
Okay, I'm going to continue. I think you can see my screen now. What are the reasons why we need to immunize? Well, we need to protect others because, as we'll talk about a little bit more in detail later, there's some people, such as newborns or even just younger children, or people who have other diseases such as HIV or other diseases that weaken their immune system, that aren't able to get immunizations. So if everyone around them has their immunizations, that's called something called herd immunity. It means that we're protecting others that can't get the immunization from getting those diseases. And then the other thing too is that it cuts down on healthcare costs. And so how does it do that? Well, if we prevent hospitalizations, that in itself, cuts down on healthcare costs. Being in the hospital, unfortunately, is not very cheap. And so if we can keep people out of the hospital from things that we can prevent, diseases that we don't, need to be seen anymore, things that we can prevent, that definitely, is a reason to get immunized. And so, like I said earlier, there are some statistics here on this slide that I wanted to kind of share as far as why it's so important to get vaccinated. And so during the 2019 to 2020 season, the CDC estimated that there was about 400,000 hospitalizations caused by flu, 22,000 deaths from flu, and then a total of 38 million flu illnesses. So, talking about flu, we do recommend that you get your flu shot every year. And basically what happens is that experts try to estimate or guesstimate what type of viruses will be in the community as far as, flu. And so every year they try to do the best that they can as far as, what what to put into the vaccine. And so, we recommend that everyone gets vaccinated yearly for flu. And then taking a look at the bottom half, they also looked and said, how much did we prevent from people getting their flu shots? So they believe they prevented 100,000 hospitalizations. They believe they prevented 6,300 deaths. So that's a lot of people that we're helping, that we're saving with something so simple as one shot a year. The only people who get 2 shots are newborns, and we'll talk about that in a little bit. But again, just statistics as far as what we're preventing, deaths we're preventing, hospitalizations we're preventing. So extremely, extremely important. And then taking a look at one of the other diseases that we don't see very, very often now because of vaccinations is measles. So if we look over to the left upper corner, you can kind of see back in the 1950s, 1960s, they were having very, very bad cases of measles. And so you can see, sometime between 1960 and 1970, that was when the first vaccine was approved in the US. And after that vaccine was approved, you can see how the numbers of measles just continued to go down. And so again, due to the vaccine, numbers went down. Then it kind of faded out and it continued to drop more. When they started to see the increase again in their numbers, that's when they recommended the second dose of MMR, which is your combination vaccine for your measles, mumps, and rubella. And after what we call, this second dose, this booster, that's what it's, that's what we call it, a booster shot, because it boosts the immune system for something that we've already given before. You can see that the numbers continued to go down. And so unfortunately, kind of around, right before the 2000s, there was this kind of myth that was started about, the measles, mumps, and rubella vaccine causing autism. And, why did they think that MMR caused autism? Well, the reason for that is because they started to see symptoms of autism between the ages about 1, 2 to 3 years old. And they thought, oh, well, we get the MMR vaccine at 1 year old, so that must be what's causing these symptoms. Well, they've done extensive research and studies, and we know that the MMR vaccine does not cause autism. What happens is we really can't pick up on autism very well until about 18 months. And so that's why your doctor, your pediatrician should be screening around the 1 year to 18 months to 2 years for signs and symptoms of autism. And so that's why we were seeing, this kind of myth going about, is because that's when we can really pick up on signs and symptoms of autism, is around that 18, 1.5 year mark. And so I can definitely say, we have given out many MMR vaccines, just in the clinic. I've never had a parent come back to me and say, this is what caused it. We have studies that say that it does not cause that. And I just want to emphasize that sometimes the social media can say a lot of things. And so I want you to really just understand that those people in social media, they did not go to medical school. They are not the ones creating vaccines. They are not the ones doing studies. And so just really cautioning what you hear in social media. And so now we're actually seeing more cases, unfortunately, of measles because of this myth of MMR causing autism. And so again, just emphasizing that it's really, really, really important for children to get vaccinated, for adults to get vaccinated, for elderly to get vaccinated. So something that I will often get asked, especially by parents who are very, very concerned about the vaccine causing things, or even adults, causing side effects. What is in a vaccine? So we can go through all of these things. So just like anything, there is preservatives, and the reason for that is to prevent contamination, right? We don't want, causing infections by giving vaccines because it's contaminated. So just like foods have preservatives, vaccines have preservatives. Then what else does it have? It has some aluminum salts. That's basically to help the body to receive the vaccine and to try to utilize the vaccine in the body as best as possible. So as you can see, where are these aluminum salts found? They're found in drinking water, they're found in infant formula, they're found in aspirin. So they're found in things that people use on a day-to-day basis. Vaccines also have stabilizers. So these are sugars, gelatin. So again, gelatin is something that we find in Jell-O. So something that, again, we can eat on, a day-to-day basis. And the reason for this is that it keeps the vaccine as effective as possible after being manufactured. So some other things that are in vaccines, there are egg proteins in certain vaccines, such as the flu vaccine. And so we'll talk about that a little bit later down the road as well. So this is to make sure that that they grow enough of the virus or bacteria to make the vaccine. So egg is a protein, right? And so viruses and bacteria do tend to flourish in proteins. And, again, vaccines, depending on what type of vaccine, there needs to be a component of that in there. And that's why they have that protein in there. There is some inactivating ingredients such as formaldehyde, and that's to kill or inactivate the toxins during the manufacturing process. So these things can be found naturally in the body. Again, at high amounts, these things are found in things like automobile exhaust, household furnishings such as carpets and upholstery. But again, this is extremely, extremely low amounts of this. Things that, this is something that occurs naturally in our body. Again, things that happen in the natural world, those amounts are very, very much bigger than what we're putting into a vaccine. And then last but not least, there is some residual antibiotics, so like your neomycin. So neomycin, it's meant to prevent contamination again. So we need to make sure that we're giving vaccines in a safe manner. And this is one of the things that definitely prevents that. So talking about the different types of vaccines, we have a couple of different types, and even more recently, even newer type. So inactivated, that basically means that this virus is dead. It's dead, it's not alive, and they use little bits of that into the vaccine along with those other components that we just talked about. So the inactivated vaccines, some of the examples is like your hepatitis A, your flu shot, not the nasal spray, the flu, your polio shot, and your rabies. So then next is your live attenuated. So these are viruses that are live. They are weakened though. And so really we don't see the effects that the actual disease would be causing. Now, anytime you get a vaccine, there's people that say, oh, well, my flu gave me the flu, or this vaccine, makes me feel sick. And the thing is, yes, I mean, definitely, you can see that after a vaccine, your body can start to feel effects because, again, we're giving you, different things, whether it be a dead virus, whether it be a weakened live virus, whether it be a part of the virus. We're giving you something that we want your immune system to recognize and build antibodies or soldiers that will go and fight that disease if you should ever get in contact with it. And so going down to the mRNA, that's your COVID-19 vaccine. So that's your Pfizer, that's your Moderna. And the way that this happens is that this vaccine goes in and it tells your body to make the proteins of the virus, of the COVID virus, to put in your body so that your body can make a good defense system. And again, very, very common side effects that we're seeing with COVID vaccines is, you can get fever, you can get chills, you can get body aches, but this is your body recognizing that this is something that is not supposed to be in the body. So what I'm going to do is I'm going to fight it. I'm going to make antibodies so that I can recognize it later so that my body does not have to go through this again. And so that's your mRNA. Next, we have like your subunit or recombinant vaccines. That's where they don't actually use the virus. They use the proteins from the virus in the vaccines. And so that's like your Haemophilus, that's your hepatitis B, your HPV, whooping cough, which is your pertussis, your meningitis, and your shingles. And then you have a toxoid type of vaccine. So basically, they use the toxins from these bacterias, from the tetanus and the diphtheria, and that's what they put into the vaccine, again, to make those good antibodies so we don't get that later. And then a viral vector, which is also pretty new for COVID-19, is that they use a virus, a very common virus like adenovirus, that kind of causes just upper cold symptoms. And they use it as a vector to get into the body to then present, the COVID-19 to the body to make the antibodies. And so let's start talking about vaccines. What do you need to actually be vaccinated with? So I just went by years, so 0 to 18 years old. So, your hepatitis B, we give these very, very often in the newborn stage. So a newborn will receive their hepatitis B shot in the hospital, then either at their 1 month or 2 month, clinic visit, and then continue to have those every couple of months. Rotavirus, again, this is something that we give in the newborn stage. It is very important to make sure you get, or newborns get this before 6 months, because if they do not, that means that we cannot give the rotavirus. It is a liquid that we give babies, but it is important to get it when you're supposed to, because if you wait too long, then we are not able to give it after a certain age. The DTaP, so DTaP is given to kids before 7, and Tdap is given to kids after 7. It's just a different combination of the diphtheria, the tetanus, and the pertussis. So tetanus, that's basically, if you step on something rusty or cut yourself with something rusty, they used to see that tetanus would cause very, very rigid muscles to the point where they couldn't breathe. Their jaw was locked. Pertussis is the whooping cough. And this is something that I really like to emphasize because even though, pertussis, we want to protect newborns, newborns cannot get their first DTaP until 2 months old. And so it's extremely, extremely important for moms while they're pregnant to get the Tdap. And so that has a pertussis in it to protect the baby from the whooping cough. And then people who are going to be around the baby, I really, really encourage to also get Tdap to protect that baby from whooping cough or pertussis. So again, extremely important. Your Haemophilus influenza type B, this used to cause very, very bad lung infections. And we don't see it very much anymore because of vaccinations. And then going on to our next one, the pneumococcal. Again, this is something that we give very, very frequently, especially in that first year for newborns. And then depending on what type of complications that person may have from the ages of 0 to 18, such as, not having a spleen, having sickle cell, having, cancer, things like that, they may actually also have to get what we call the pneumococcal, but it's a 23. But for, babies that don't have any of those complications, for children that don't have any of those complications, we give the pneumococcal the 13. The inactivated polio virus, again, a virus that used to cause devastating effects on the body where people could not talk, people could not walk. I have patients that are older that unfortunately had polio and still have very, very abnormal walking. And so again, preventing those complications by getting vaccinated. We talked about influenza. So for newborns, we give influenza at 6 months, and then we can give it again a couple months later, or even at their 1 year. After that, we just recommend yearly. I do have a 9-month-old daughter, and she has been receiving all of these vaccines that I have been talking about. And so I do like to tell my patients that I believe in these so much that I trust these vaccines for my daughter. Again, MMR, that's something that we give at 1 year old. Varicella is another vaccine that we give at 1 year of age. That is what causes chickenpox. And so I remember stories of my mom telling me that I was, just being bathed in oatmeal baths. And so chickenpox can get severe in some cases. And so again, trying to get those vaccines. Hepatitis A is also another one we give at 1 year old that prevents, viruses like GI viruses, type of symptoms. HPV, HPV is, one of the newer ones, I would say. It came out when I was maybe in, younger, in my teenage years. And so at that time, there wasn't a lot of studies that, we could look back on. However, now, we have a lot of good evidence that the HPV vaccine really is helping women from not getting cervical cancer. And so HPV is a vaccine that we like to, there's different ways that we give it. If you give it before 15, we only need to give it in 2 doses. So I recommend at the age of 11 to start getting HPV vaccine. And if you're after the age of 15, then you do need a 3-dose series. It has come up now. It used to be that the max age that we would give is 26. Now it is 45. But again, the way that we prevent diseases is from giving them before they happen. HPV is not a sexually transmitted infection, but it is transmitted through sex. I know that sounds kind of weird. And so if we can get girls and boys vaccinated, at a very young age, we can prevent things like cervical cancer, anal cancer and stuff like that. And then your meningitis, there's two types. So there's the ACYW and then there's the type B. So we definitely recommend at the age of 11 to 12 getting your first dose of the meningococcal, the ACYW. And then at the age of 16 to 18, we do recommend that second dose of the meningitis shot. There are colleges that are now not recommending, they're requiring the type, the B, the meningococcal type B vaccine. That is separate. So if you get, the ACYW at 11 to 12, we can't use the meningococcal B as your second dose. It is separate from the ACYW. So basically what we're seeing, or what we're having to do now, is give a dose of the first at 11 to 12 and 16 to 18. And then a couple months later, doing that 2-dose series for the type B for patients who are going into college, whose colleges are recommending that. Okay. And so let's talk about vaccines for people who are 18 and up. So again, extremely, extremely important for flu shots yearly. Now, there are a couple of different flu shots. There is first there's a mist or a nasal mist that can be given. That is a live flu vaccine. And so I honestly have never used that one. Whenever we give flu, we give it through the shot, but it is available. There's flu shots that have 2 types of influenza A and 1 of type B, versus your flu shots that have 2 types of influenza A and 2 types of influenza B. And so, I definitely recommend the more coverage you can have, the better. And then we also have our high dose flu shot that we recommend for people who are 65 and older, or who are 65 and younger and have a lot of comorbidities like chronic kidney disease, diabetes, uncontrolled hypertension, cardiovascular disease, heart disease. And so that's a lot of our patients down here in the Valley. And so if you can get the high dose, that is what we recommend. Now, if you can just get the regular dose, or for whatever reason don't tolerate the high dose, then I would at least recommend getting, your normal strength influenza on a yearly basis. And you want to get the influenza vaccine at the end of September, October. The earlier the better, because again, we give these vaccines to prevent the disease or to prevent symptoms. I also like to emphasize that we encourage flu shots, because what we also do see is, especially in the elderly population, is that if they get their flu shot, if they do, for whatever reason, do get flu, they tend to have it less severe. So, less body aches, less fever, less shortness of breath, less likelihood that they're going to develop a pneumonia that will put them in the hospital, or require oxygen that puts them in the hospital. So even if we're not 100% preventing, we are at least trying to minimize symptoms to prevent hospitalizations. And again, talking about this Tdap, we do recommend that you get your tetanus, which is the T in the Tdap or the T in the TD, every 10 years. If you do have an incident of like a very large wound that you had from a rusty nail, depending on how long it's been, you can get it before the 10 years, depending on how the wound looks. So there's two different ways that you can get your tetanus. You can get your tetanus through the Tdap, which has the tetanus, the diphtheria, and the acellular pertussis, or you can just get it where you have the tetanus and the diphtheria. Now, again, if you're going to be around newborns or people that are immunocompromised, I would recommend trying to get as much coverage as possible and getting the Tdap. You can get that one every 10 years. Or if you're not in that situation, you can just get, the regular TB. The zoster recombinant. So it used to be that the zoster vaccine was just a one dose. And we got some pretty good results from it. But the newer one, where we give the 2 doses, that one has been shown to be extremely, extremely effective. And what's important to know about so zoster is what causes shingles. So if you've ever had chickenpox, what happens is that the chickenpox virus, it goes and it hides in your neurological symptom in the spine. And so it'll be dormant, it'll be sleeping, kind of like when bears go into hibernation, right? They'll sleep for all winter. So basically what this virus does is it hides from the body, and then there's different things that can happen. So increased stress, more comorbidities that causes your immune system to be weakened, can kind of bring down your immune system and let this virus come back out. And so the way that it comes back out is through shingles, where we see that rash in that very, very distinct pattern, what we call in a dermatome, or just one section of the body, normally just on one side, very, very rare for it to be on both sides of the body at the same time. And so this virus comes back out into the system and causes that. And so again, important for little kids to get their varicella so they don't have to worry about having, that virus in their system. And then people who have had it, very important to get their zoster vaccine. Now, it used to be that zoster, we couldn't, the shingles vaccine, we couldn't give until about 60. Now they've brought it down to 50 years old. Now, getting it covered is sometimes very, very difficult by insurances, unfortunately, but it can be given at the age of 50. And we know that from statistics, 1 in 3 people will get the shingles virus, which is extremely, extremely high. So if we can give this vaccine to try to prevent that, and prevent complications, because again, it affects, your skin, it affects your nerves. So some people can have, extremely bad nerve pain, for up to a year or more, depending on how bad they get it. So definitely making sure to get your shingles vaccine. HPV, we kind of touched a little bit on that, on the 0 to 18-year-olds. It is, it can be given up to the age of 45. But again, we want to give it before the virus gets in the system. And so if you're sexually active at a younger age, you're more likely to get HPV. And so getting that vaccine before you're even sexually active is the best thing to do. And then talking about, your pneumonia vaccines. This vaccine has had many updates in the last 10 years. So it used, even, during my training, we were taught that, at the age of 65, we give, the 13, and then a year later, we give the 23. New guidelines are now saying that, 100% people need to be getting the pneumococcal 23. And so it really is going to be a discussion with your doctor if they feel like the pneumococcal 13 will be of any value to your health. If, you know, basically what happened is that we see more prevention of pneumonia in the elderly from pneumococcal 23 vaccine. And that's why that one has become definitely that we need to be giving it at the age of 65. The 13, we weren't seeing very, very good results as far as prevention into the hospital. It was more the 23. So again, a talk that you would have with your PCP about whether you need to get both. If you do get both, you can get your 13 at 65 and then a year later get your 23. If you have already received, you know, the pneumococcal 23, you can get your pneumococcal 13 a year later. So that is not a problem. The other thing that's really important too is that people, again, who are immunocompromised, and there's a list of diseases for people from 18 to 65 that we give a pneumococcal 23 vaccine to before they turn 65. And a lot of those people, you know, again, it's those comorbidities, it's people who are immunocompromised and things like that. And then you can, between the ages of 18 and 23, get that meningococcal B, or, you know, that type B vaccine, you know, especially if people are in college or your school is requiring it. Let's just say you go into school, you know, a little bit later, or you switch schools and they require it, you know, you can get it up to the age of 23. And then these are my sources. What I really, really encourage people to do, you know, because we do have such good resources now on the internet, is go to the CDC website, and, you know, look into the vaccinations and, you know, do research. If you have, you know, concerns, that you have questions about, that website is extremely good about answering very, very common questions that patients tend to have. And then also just having a good conversation with your primary care doctor as far as, you know, what you need, at what time you need it, and that sort of stuff. Something that I did forget to touch on as far as the flu shot, because it does have that egg protein in it. You know, there are some people that will say, oh, well, I'm allergic to eggs. And so basically what the recommendations are for that is, if you have had hives, or, you know, where you get your, you know, the skin itchiness from eggs, you can still get the flu shot. Now we do monitor you a little bit longer. So instead of monitoring you, you know, 10-15 minutes, we monitor you about 30 minutes in the office. Now, if you've had what's called an anaphylactic reaction, or a reaction where you can't breathe, you get short of breath, your tongue swells up, the recommendations are that you still can get it, but you need to be in a hospital setting. So, I mean, many patients, you know, I totally understand, you know, their concern and, you know, not wanting to get it. But those are just the recommendations from the CDC. And then if you ever had an anaphylactic reaction to any vaccine at all, you know, where you get short of breath, you can't breathe, your tongue swells up, definitely you cannot get that vaccine again. So that's, you know, definitely a contraindication, or something that would prevent you from getting, you know, a booster shot of that vaccine and so forth. And that is my presentation for today.
Well, thank you so much, Doctor. Thank you so much for the presentation. At this point, we're going to start with the QA session.
There's some questions here. Let me see.
Yes, we do have multiple questions. So the first one that we have is, should a person wait between taking the first or second dose or the booster of the COVID-19 vaccine?
So I see, is it safe to immunize teenagers with COVID vaccine?
Yes, that's another.
So right now, Pfizer is the only one. Oh, okay. We're answering live.
No, doctor, it's okay if you want to go ahead and expand a little bit more on is it safe to immunize
You want me to go ahead
teenagers?
and answer that question?
No, you can go ahead and do it, doctor.
Okay, okay. So the only vaccine that has been approved for 12-year-olds and up is the Pfizer vaccine. Now, again, these studies that they did on this age group are very, very short studies, right? Because we're in a pandemic, we're in a situation that we haven't been in for a very, very long time since the last pandemic. And so these studies are very, very short, but they did not find that there was any deaths. And so it's kind of hard to answer that question because, again, the studies are very, very new, they're short, and we can just kind of go off of that very small population. From what I've heard, I haven't heard of anyone having an extreme reaction in that category of people. Even the side effects tend to be less, and we're not very sure why. We don't know if because the immune system is still building during those years, if that's why we're seeing that. What I have been telling patients here in my clinic is, if you're hesitant, you can wait, 2 weeks, a month to kind of see if there's anything that pops up. Because if we're going to see something, it's going to be in normally in that amount of time, especially the very bad things, we're going to see it, in 2 weeks to a month. And right now they're actually doing more studies and even at younger populations. So, I've gotten asked, am I going to vaccinate? If it comes down to it, like, if it gets approved, am I going to vaccinate my 9-month-old? And I can honestly say I'm not sure yet because I haven't seen the studies. So it's very, very difficult to answer. We want the more people that get immunized from COVID, the better, right? The faster we're going to be able to get back into society a little bit easier. But it's just very hard, especially when it comes to your kids. It's just, I feel like a soft spot. I hope I answered that. Okay.
Dr. Gutierrez, we do have another question that has come to our chat.
Let's see.
So,
is zoster recombinant or shingles vaccine given only once? So the newer one, and I'm sorry, I believe it's called the Shingrix. The name sometimes. Let's see. Yes, so the newer one called Shingrix, that is a 2-dose. And that's the one that I was talking about. That is a newer one that we see, I believe it's about 90-something% to prevent shingles versus before with the, what was it called? I can't remember what the other one is called right now. But the one that we only gave the 1 dose, it was not as effective. It was about 60-something% effective versus the zoster recombinant or the Shingrix that is about 90-something% effective from preventing shingles. The handout, I can definitely send the handout for that to be given if you all want. How common are allergic reactions to certain vaccines? So I definitely cannot give you a percentage, but I can tell you it is fairly rare that we see a reaction. Again, certain vaccines have that egg protein that we talked about in it. And if you do have, allergy or an allergic reaction to that, again, that's something that you have to let your provider know what type of reaction you had, and things like that. As far as, the COVID, I haven't seen any allergic reactions in the literature, the studies. Again, very rare to see allergic reactions. But I apologize, I don't have like a specific number for you today. Are there any studies on the overall health picture of vaccinated versus unvaccinated children, overall hospitalizations versus clinic visits? Again, I don't have, I don't have that. I don't know if there is a study on that. All I can say is that, if kids aren't getting vaccinated, they are more likely to get these diseases that we should be eliminating in society because we do have these vaccines. And so overall, I would say if you are vaccinated, you're less likely to need hospitalization or clinic visits from things that we're preventing. How long is COVID-19 vaccine last in our bodies? That's a good question. So even right now, they're still seeing if, even if you've gotten the vaccine, if you need a booster shot. So just like our other vaccines that we need booster shots, sometimes it's every couple, between months versus the flu that we get every year. I don't have an answer for you right now, how long those antibodies are lasting, again, because, we just started giving vaccines fairly recently. But again, the CDC is doing a lot of research on, how long these antibodies are lasting from our COVID vaccines and things like that. Who performs the safety studies on vaccines? Where can we see those studies? And so there's a couple of different places. So there is, the website, it's called the ACIP. Let me get you the ACIP vaccines. So the CDC will sometimes give you vaccines. There's something called the Advisory Committee of Immunizations. That's that ACIP that I was talking about. They have their own website, concerning vaccines and things like that. Something even that you could do is like Google Scholar and, put in, whatever question you have for that specific vaccine as far as safety studies. So anything that's given here needs to be FDA regulated. So like, the COVID vaccines that just came out, they had to be FDA regulated. The CDC looks at it. If there's other committees that do that, I can't remember them right now, but those are the few that I can tell you that vaccines do need to go through, in some places where you can see that. Should a person wait between taking first or second dose or booster of COVID vaccine and the flu vaccine when they become available? So going based off of the studies that they were doing for the younger population, so they were saying that the 12 to 18, for them not to get their regular vaccines and the COVID vaccine together. Previously they were saying at least wait 2 weeks before you get it. We don't know if it's gonna compromise the other vaccines. And now they have come out saying that in younger kids, we actually don't need to be waiting, that we can actually give the COVID vaccine and other vaccines at the same time. Now, with flu particularly, I haven't seen a study come out for that. Again, I apologize. All of this is very, very new, and just things, pop up from day to day. I mean, I don't think it would be a bad thing to wait a 2-week period if, you want to be on the safe side. And again, 2 weeks is not a very long, it's not too long of a time. But at least kind of going back to that, to the younger population, they are saying now that they can get regular vaccines with their COVID vaccine at the same time. Please discuss the need for COVID-19 booster, and can it be another type brand of vaccine than what was originally provided? Again, I don't have a good answer for that. They were previously doing, the last time I had checked, studies to see if we could do like, get your first dose of Pfizer and then get your second dose of Moderna, or get your first with Pfizer and get your second with Johnson & Johnson. But I haven't seen anything pop up recently. Again, it can be out there, maybe I'm just missing it, but I don't have a specific answer for that. Is it recommended to check for varicella antibodies after several years? I asked because while working in public school, I saw almost annually a case of chickenpox in middle school, despite the individual having both doses of vaccine. Can people's immunity age or lose those antibodies over time? Yes, so antibodies can be lost over time. And so anytime, specifically in the healthcare world, you're going into school, they ask for you to get checked for your like hepatitis B antibodies, your varicella antibodies. And so sometimes we do see people that their body just kind of grows out of the vaccine for whatever reason. And so, for your hepatitis B, you do have to get that 3 series again in your adulthood. Your varicella, again, you can get it in adulthood as well. But yes, there's some people that can lose antibodies. And so is that something that school should be asking for? I'm not sure, but we definitely do see that there's some people, for whatever reason, don't respond. Now, something also to consider as far as, why this is happening. Vaccines, again, they have different components in them. And if they're not being stored at the right temperature, if they're not being handled in the appropriate way, can lose some of their effectiveness. So, is that why we see that some people lose their antibodies after, some years, being young or into adulthood? Maybe for whatever reason, their body just didn't get that immune response like we would normally see. Having taken the COVID and shingles vaccines too close, COVID 1 month and shingles, but all within 4 months, can they make a person feel sick? Maybe not enough studies from having those all too close together, maybe a reaction too close, like body aches and feeling tired. So, these are definitely viruses, that are being put in, well, depends. So COVID, that's the mRNA, and then the shingles is at recombinant. So it's a protein of the basically the shingles virus that gets put into the vaccine. Again, your body has to react to it. And, again, we don't have very many studies right now. And so whether some bodies can take, these different vaccines all at one time, it's probably more of a person-to-person type thing, just like there's some people that don't get any side effects from the COVID versus some people who get extreme symptoms from, the COVID vaccine. I would say we don't have like, if you have these certain illnesses, then you need to spread it out this much. or if you have this, we need to spread it out this much. We don't have that right now. And if you're feeling sick, I would definitely follow up with your PCP just to make sure that there's nothing else, kind of causing these symptoms that you're having. No doctor has ever told me to check antibodies. I'm not sure if the doctors know. So normally we actually don't have people come into the office and we check their antibodies. It's normally when they're going into like a healthcare, like if they're going into nursing, if they're going into medical school, if they're going into any type of healthcare career where they're probably going to be exposed to people that have a lot of different things. That's normally where I check patients' antibodies. Now, if people want to check their antibodies, I have no problem. The only thing too is sometimes that insurance won't see it as appropriate. And so again, sometimes it can just kind of be difficult with the insurance picking that lab test up to check those antibodies. But yes, there are definitely, it's a blood test that we do to make sure that you have antibodies that are still protecting you from certain diseases. What happens if you get vaccinated and try to donate plasma? Does it affect us in any way, or does it remove some of the vaccine? So, I definitely wouldn't recommend. So I don't know, the last question, are we talking about COVID, the COVID vaccine, or any vaccine in general?
I'm guessing she's
I guess let me do both.
COVID-19.
So COVID, we know that we don't get the full antibody effect until 2 weeks after that second dose. And so I really, really wouldn't recommend donating anything till at least 2 weeks, until your body, is able to make those good antibodies. Now, if you donate in 2 weeks, are you losing some of those antibodies? Not sure, but something that you could do, if you do want to donate blood or plasma, is at least wait those 2 weeks, even a month if you want to kind of be more on the safe side, donate and then check to see if you have, those antibodies. But as far as right now, we do know that it at least takes 2 weeks for your body to 100% build those antibodies to COVID. Now, other vaccinations, I don't know what the time span is as far as how long it takes for the antibodies to build. But again, I would guesstimate in my education, maybe about 2 to 4 weeks for your body to have that type of response to build those antibodies. Okay.
Well, thank you so much, Dr. Gutierrez. Thank you so much for being with us this morning.
Well, I thank you guys for listening today. I hope I explained things, good enough. And, just really, really emphasize just the importance of vaccines. I get my flu shot every year. I got my COVID shot. When I get older, I'm definitely getting my shingles vaccine and my pneumonia vaccine, and things like that. I appreciate you guys listening. Y'all have a good day.
Thank you so much, and thank you for everybody who joined us today. Please make sure that you visit our website for new upcoming events, and thank you for everything. Have a beautiful day. Thank you, and stay healthy.